Hello, and thank you for taking the time to listen today about your 2024 Open Enrollment with Venture Mechanical. Open Enrollment will begin today, Thursday, February 1st, and must be completed by Thursday, February 15th. Should you log into the system after the 15th, even on the 16th, the program will be closed and you will not be able to make elections. Any elections made during open enrollment will go into effect as of March 1st, 2024, and will continue through February 28th, 2025, unless you experience a qualifying life event. Qualifying life events include marriage or divorce, the birth or legal adoption of a dependent, and the gain or loss of coverage eligibility elsewhere. Please note that any qualifying life events that you experience must be reported within 30 days of the event to make changes to your benefits. All elections will be made through UKG, which is the same system that you have been using, and we do ask that everybody logs in to make elections. This is because we are making some changes to your benefits this year, including changes to your dental and vision, and we want to make sure that we capture those correctly. In addition, we do want to make sure that you update your beneficiaries. So, who can enroll on these benefits? First and foremost, any employee who has completed their waiting period and is working full-time is eligible for these benefits. Your spouse or common law spouse is eligible as long as you have provided proper documentation and they do not have other coverage through their employer. Your children who reside in your household, you primarily support, whether they are legally adopted or stepchildren, are all eligible for the benefit as well, up to the age of 26. If they are above the age of 26, they must be considered disabled to remain on benefits. Today, we are primarily going to be focusing on your medical, dental, and vision, as these are the benefits that you have the opportunity to elect during open enrollment. But we will also be discussing your life and disability benefits as well. So let's talk about your medical plan. You will be remaining with UMR this year, meaning you have access to the same United Healthcare Network doctors, but we've made some adjustments to the plan that's actually pretty exciting for the employees since it does create some savings on their side. First and foremost, we made some changes to your out-of-pocket maximum. You'll notice this year that you have a single out-of-pocket maximum of $6,000 for an individual and $12,000 for a family. Now, in the past, your out-of-pocket maximums were split between medical coverage and prescription coverage. So last year, your out-of-pocket maximum medical for individuals was $4,000 and $8,000 for a family. Your prescription out-of-pocket maximum for an individual was $3,000 and $6,000 for a family. So when you add these up, an employee individually was responsible for $7,000 of out-of-pocket maximum costs, and a family was responsible for $14,000 of out-of-pocket costs. So as you can see this year, we've brought that all together. So no more completing and thinking you've fixed your out-of-pocket maximum and then you find out you have to pay more just based on whether it was medical or prescriptions. Now it's all in one, and you'll see that we've actually reduced that from that $7,000 total to $6,000 for an individual, and then you're reducing the family cost as well to $12,000 for a family instead of $14,000. So it is a slight change, but it's actually to your benefit. We're really excited to see that line up and then improve for you. In addition, you'll see that your deductible has also gone down in cost. So instead of $800, an individual now has a $500 deductible that they need to meet. And instead of $2,000 like it was last year, families now get to only pay $1,000 for their deductible. Your coinsurance is still remaining the same, and your preventative care copays will stay at 100%. Now, we also made some adjustments to some of your copays. Your specialist and urgent care copays will remain the same, but we have actually reduced your primary care copay down from $40 to $20, so that's been cut in half. And you now have a telehealth or teledoc copay of $0. So for a lot of those minor issues that you might encounter, you now don't have to pay anything to reach out via teledoc to a doctor and get some help. There is also an emergency room cost of $250 copays, then 20% after your deductible. Please keep in mind with the emergency room, if you are admitted, that copay is waived. However, we do highly suggest seeking either urgent care, telehealth, or primary care for non-emergent services. When you go to the emergency room and it's not a true emergency, it does end up costing you quite a bit more than utilizing one of your other resources. Your prescriptions will still be administered through Optum Rx. You have a $0 copay on your generic prescriptions, a $40 copay on your brand prescriptions, and a $60 copay for your non-formulary brand prescriptions. Now, this is if you go into a retail pharmacy and pick up a 30-day supply. You also have the opportunity to select mail order, which allows you to get a 90-day supply. In those instances, your cost is still $0 for a generic, $50 for a brand prescription, and $80 copay for a non-formulary brand prescription. So if you can order via mail, it creates some great savings for you, as well as just the ease of use of not having to go anywhere to pick it up. It just comes straight to your door. So let's talk a little bit more about telehealth. Teledoc allows you to reach out to a doctor for issues such as allergies, asthma, cold or flu, ear infections, pink eye, if you have a rash. It's a great way for you to seek services without having to go into a brick and mortar office. Sometimes if you're trying to wrangle the kiddos and get through the door and get to the office, it can be a big hassle, but this allows you to access a doctor at any time via your phone. So it's a great way for you to have access no matter where you are or what you're doing. And what's even better is this now comes to you at no additional cost. So there's a $0 copay to you to use this. We highly encourage you to take advantage of that. If you are needing to seek services, it's just a really awesome resource to you that Venture is providing. We also wanted to remind you about the different places to go when you're seeking care. As I just mentioned on the slide previously, virtual care or teledoc is a great option for you for minor illnesses. It allows you to seek services at very low cost, $0 in this case, and you can access a doctor 24/7. Now, if this is non-urgent care, but your illness is a little bit worse, maybe you need a better examination, potentially a vaccination, we highly suggest going to your doctor's office first. This comes to you if you're going to the PCP at a $20 copay. So again, it's a lot less expensive to you than moving on to, let's say, urgent care or the emergency room. However, we know sometimes it can be very difficult to get into your doctor. Maybe they're all booked up. Maybe you have a minor broken bone. You really need some help right now, an allergic reaction, things like that. At that point in time, please try to utilize urgent care. We don't just say this for the sake of the plan. We really say this for the sake of your pocket. Urgent care costs you $40 for a copay. They're able to see you quickly, and you're able to have those issues treated immediately. If you go into the emergency room, it is always going to cost way more than it would have cost with urgent care or your PCP. Emergency rooms, again, are a $250 copay minimum. And then you have to take in consideration that they're going to be charging you 20% coinsurance, meaning if you have not met your deductible, you will not only be paying that copay, you'll be paying to reach your deductible, and then you'll be paying 20% of whatever additional costs you have. So we really urge you to stay away from the emergency room at all costs unless it is a true emergency. Of course, if you are having a true emergency, such as, a head injury or a spine injury, you're having seizures, you're having a heart attack, please, please, please seek services as quickly as possible. Of course, go to the emergency room. But we're just trying to help you navigate and understand that there are other options for you when you do need more immediate care and it is not truly an emergency. This year, the dental plan is moving from UMR to United Healthcare. Now, your plan itself has the same benefit build. So your annual maximum will continue to be $1,750 per person. As a reminder, your annual maximum is the most that your benefit will pay for your services. Your annual deductible remains the same at $50 for an individual, $150 for a family. And your diagnostic and preventative services, which includes your exams, cleanings, and fluoride treatments, that will remain at 100% covered. Your basic services will be covered at 80% after deductible up to the annual maximum, and your major services will be covered at 50% after deductible up to the annual maximum. You have a separate lifetime maximum for orthodontia of $1,500 per child, and that will also be covered at 50% up to the annual maximum after deductible. So what's the biggest change with this plan? Well, you now have in-network coverage. In the past, you were able to go to whatever dentist you want, and essentially you can still do that. The main difference is when you go in-network, you're able to see considerable savings of cost to you. So the biggest difference that we had in the past with UMR is no network, meaning that there was no contractual agreement with dentists requiring them to meet certain terms within that contract, which included special pricing. So when you go to any dentist that you want and they're not considered a network, they are able to charge you whatever they want for that service. Your benefits will still cover up to a certain amount. However, usually you end up with a balance bill that's a little bit higher than is desirable, right? Well, going in network requires the dentist to charge you a much lower amount than they would have before. So some of your dentists, when you go in network, could still be in network. It doesn't necessarily mean that they're all out of network for you. United Healthcare has a pretty robust network, which is really exciting and gives you a lot of opportunities to seek in-network care. The difference being that something that might have been charged for $500 when it was out of network now has a contractual agreement to only be $200. So there's a lot more savings to you that is passed on. Now, in order to look up dentists, you have a couple different options. The first and easiest is logging into your My UHC account and doing the preferred dental provider search. So it's just like when you look up a doctor for your medical, except this time you're using it to look up dentists. And you'll be able to filter that by preferences of distance from where you live or the office. You're able to filter that based on if they are an orthodontist specialist or just a regular, family practice. So there's a lot of opportunity there to look for dentists. If you have a certain dentist that you're extremely concerned about, please wait until the end of this presentation and reach out to us and we'll be able to check to see if they are a network for you. However, we do ask that you try to look through your My UHC option first. We know sometimes people have some trouble online, so if you run into problems, please don't hesitate to reach out. This year, your plan is changing from the UMR reimbursement plan for your vision over to a United Healthcare vision benefit plan. So the main difference is just like the dental. Again, you're going to have in-network and out-of-network providers, but this is truly to your advantage. When you go in-network, you're going to see huge amounts of savings from what you were paying before out of pocket for your vision costs. Again, you can look up providers just by going to your My UHC portal, but if you do ever run into trouble finding a provider, please let us know. We can help you also look those up. So on this plan, when you go in for a vision exam, you pay a $10 copay. Now, there are some limitations here. You're only allowed one annual exam, so one exam for every 12 months. But on your prior plan, you may have paid $150 just for the exam alone, and instead you're paying $10. For your lenses, it's a $25 copay. Now, what this means is, let's say you go in, you get your vision exam, and you like your frames, but you just want to update your lenses to the new proper prescription. All you pay is $25. They'll go ahead and get those new lenses for you. Again, you can update your lenses once a year, so every 12 months. For frames, you actually get an allowance that is just going towards that. So for your frames, you're able to update them once every 24 months, so once every 2 years. You receive a $150 allowance plus 20% off the balance. So for instance, let's say you decide that you want to get a pair of frames that cost $250. Well, $150 of that is already wiped out by the allowance, so now you're looking at $100 remaining. You'll get a 20% discount and you'll be responsible for the rest. So $80 and you've got those frames. You do also have the opportunity to elect to get contacts in lieu of glasses. In that instance, you would pay $30 copay for your contact fitting and evaluation. You're able to do this once every 12 months again. And you also get a $150 balance towards your contacts. So if your box of contacts costs $250 once everything's said and done and you've figured out exactly which set you need, you have that $150 allowance that goes towards that immediately. And again, 20% discount, so you're paying $80 for that box of contacts. This is a really awesome change for you guys because in the past, $300 could get wiped out super quick when you have no contracts in place stopping providers from charging you whatever they want. Now, you can still go out of network, but again, it really is not to your advantage. You're going to have to pay everything up front and submit for reimbursement. And what you're going to see is the reimbursement level is very low. So please try to go in network if you can. As a reminder, you do have an FSA and dependent care savings account available for you. Now, these are not something that you'll be electing at open enrollment. That already occurred earlier in January, but we like to remind you again that you have these funds available to you and to spend them. You can use your flexible spending account for your medical costs as well as your dental and vision costs and tons of other things. Even Amazon and different vendors now have FSA eligible items. So just a quick reminder about the additional benefits that are available to you. We are also going to quickly review your life and disability coverages. Now, we aren't having open enrollment for these coverages. It's just a reminder that the benefit is there for you, as well as a reminder to update your beneficiaries. So you do get basic life covered at 100% by Venture. This covers you for one time your annual salary up to a maximum of $250,000. When you enroll for the first time as a new employee, you also have the opportunity to elect voluntary life and AD&D. This is in increments of $10,000 for an employee up to $500,000, for $5,000 for a spouse up to $250,000, and for kiddos, it is a $1,000 increment up to $10,000. Now, keep in mind, as you get older, there are some reductions that come into play. It's 67% for age 70 and 50% for age 75. As a reminder, please take a moment to make sure that your beneficiaries are updated. Of course, we hope that nothing happens to you, but if it does, we want to make sure that the right people do receive that payment so that they are able to handle anything that might come from that. You're able to update your beneficiaries in UKG, and we just ask that you take that moment to do so. You also have two different types of disability covered at 100% by Venture Mechanical. So again, this is no cost to you. It's just some added protection in case something goes wrong. So let's say you're really sick or you've gotten hurt and you've been out of work for at least 14 days. Of course, there's going to be some stress about how you're going to afford to pay for your bills and how you're going to handle everything. Well, the good news is you have short-term disability. So your short-term disability kicks in after you've been out of work for 14 days. It covers you for 60% of your weekly earnings up to a maximum of $1,500 per week. Now, this lasts for 11 weeks, and there are some pre-existing conditions that may apply. If you are still sick and you're still out of work after all of that 11 weeks has gone by through your short-term disability, there is also long-term disability available to you. So this benefit lines up with your short-term disability. After you have been out of work for 90 days, you're able to receive 60% of your monthly earnings up to a maximum amount. Now, keep in mind that this can pay you forever until you reach the age of 65. And if you are actively working and over the age of 65, there is still a payout schedule for this. It just does not last as long as, of course, if you were to go out on disability at age 40. Again, this plan does have some pre-existing conditions, so you can't go out on the same disability multiple times consecutively in a year. It's one of those things that they're trying to, of course, protect themselves as well. And with these disability policies, you also have some value-added benefits. There's several different value-added benefits that you get through New York Life, including legal assistance, financial planning, estate guidance, and travel assistance. All of these resources are free to you just for being an employee with Venture and having these benefits in place. You also have a great benefit, which is an employee assistance program. Now, this benefit is also through New York Life, and it allows you to seek help for tons of different things, whether you're experiencing maybe work stress, anxiety, depression, anything that you are finding that could potentially be affecting your life, and EAP is a great resource to start with to seek help. This is something that's available to you toll-free. It's available 24/7. And what's really great is you get 6 sessions, and it includes, short-term counseling sessions, referrals to crisis services, same-day appointments, and this is per issue. So let's say early in the year, you're struggling with some work stress, you can call them about that and use some of your sessions, up to 6 sessions. Then let's say later on in the year, you're feeling anxious. That doesn't mean that you can't still seek help. You get another 6 sessions for that. So it's a really great benefit that's available to you and your family members, and we highly encourage that you try to utilize it if you need it. So this year, you'll see that your medical contributions did not change. However, there is a slightly different structure for your dental and vision premiums. So in the past, when you elected medical, you were automatically enrolled in dental and vision. However, this year, when you elect medical, you have the opportunity to elect or waive dental and vision. If you waive medical, you also have the opportunity to elect or waive dental or vision. Along with this, if you enroll as employee only on medical, you have the freedom to enroll as employee plus children or employee plus spouse on the dental, and the vision vice versa. So there's a little bit more freedom with your choice. However, because we are making these changes to the dental and vision plans, we do need to have everybody log in. So this is just another reminder where I really encourage you to make those elections. We really need you to go in there. For the medical premiums, as I mentioned, they are not changing costs this year. So you're looking at $80 monthly for employee only, $390 for employee plus spouse, $340 for employee plus children, and $505 monthly for employee plus family. Broken out biweekly, that is $36.92 for employee only, $180 for employee plus spouse, $156.92 for employee plus children, and $233.08 for employee plus family. The dental premiums are very low, as you can see. For employee only, it is $5. For employee plus spouse, it is $10. Employee plus children, it is $12. And employee plus family, it is $15. Broken out bi-weekly, that is $2.31 for employee only, $4.62 for employee plus spouse, $5.54 for employee plus children, and $6.92 for employee plus family. The vision premiums, again, are very low. One of the best things about Venture this year is they're really beating out their competition as far as the actual cost of coverage to their employees. So for the monthly cost for employee only on the vision plan, you're looking at $2. You're looking at $3 for employee plus spouse, $4 for employee plus children, and $5 for employee plus family. Broken out biweekly, that is 92 cents for employee only, $1.38 for employee plus spouse, $1.85 for employee plus children, and $2.31 for employee plus family. We also have a mobile benefits app, which is a great resource to you. It's coming out on March 1st, so keep your eye out for those updates as they become available. But this app is really great. It allows you to access your benefits information off of your phone, off of your computer. Basically, any device that can access the internet can go onto this app for you. And it'll have things like your benefit guide. It'll have different links to help you access telehealth, your dental benefits, medical benefits. And it will also have a generic ID card for you. Now, it won't have your name on there, but if you're looking for, generic information such as your plan numbers, that will also be available on this mobile benefits app. We do also offer flip books. Now, this is the same as your printed benefit guide, but it's available to you in the palm of your hand electronically. So as you'll see, there's 2 QR codes here. We have one for the field and one for the office. And again, it just lets you flip through and see the different benefits available to you instead of holding the physical book. We will be opening up this presentation for questions at this time, but please note if you do ever come across questions later on or you realize that there's something you forgot to ask, you can always reach out to your HR team and they will be able to assist you with getting some additional information and questions answered.